Any number of conditions can make you sick to your stomach after a meal, from food poisoning to pregnancy. A closer look at your other symptoms can help you pinpoint what's causing your nausea. Once you've identified the problem, your doctor can help you find a treatment that will stop you from getting sick to your stomach. Then you can enjoy your meals, nausea-free. Hi, I'm Joshua and I am here to help you with your stomach pain relief here in the Stomach Health channel. Now, let's continue with the video. Causes. There are many conditions that can make you nauseated after eating. Food allergies. Certain foods, like shellfish, nuts, or eggs, can fool your immune system into identifying them as harmful foreign invaders. When you eat one of these trigger foods, your immune system launches a series of events that leads to the release of histamine and other chemicals. These chemicals produce allergy symptoms, which can range from hives and mouth swelling to nausea. Food poisoning. Food that sits around for too long or isn't properly refrigerated attracts bacteria, viruses, and parasites that can make you sick. Food poisoning symptoms like nausea, vomiting, and diarrhea typically start within a few hours after you've eaten contaminated food. Stomach virus. This common bug, which is sometimes nicknamed the stomach flu, infects the intestines and triggers gastrointestinal GI symptoms like nausea, vomiting, and diarrhea. You can catch a stomach virus by getting too close to someone who's sick or by eating food or drinking water that's been contaminated with the virus. Pregnancy. One of the earliest signs that you're pregnant is an uneasy, queasy feeling, which often starts during the second month of your pregnancy. Changing hormone levels trigger pregnancy nausea. Though it's officially termed morning sickness, nausea can strike at any time of day, including mealtimes. Sometimes the smell or taste of certain foods is enough to make your stomach roll. The feeling is temporary, and it won't harm you or your baby. Acid reflux. A burning feeling behind your breastbone, known as heartburn, is the hallmark symptom of gastroesophageal disease, GERD. But this condition can cause nausea, too. GERD happens when the muscular valve between your esophagus and stomach malfunctions, allowing stomach acid to leak up into your esophagus. Anxiety and stress. Stress doesn't only take a toll on your emotions, it affects your physical health, too. A difficult breakup or job loss can make you lose your appetite or feel sick after you eat. The nausea should let up once you get your stress under control. Cancer treatment. Some chemotherapy drugs cause nausea as a side effect. The nausea should go away after you finish the treatment. Gallbladder disease. Your gallbladder is an organ that sits in the upper right side of your abdomen. It helps your body digest fats. Gallstones and other gallbladder diseases can affect your ability to digest fats. As a result, you'll feel sick to your stomach, especially after you eat a rich fatty meal. Irritable bowel syndrome, IBS. IBS is a collection of GI symptoms, which can include abdominal pain, diarrhea, and constipation. Nausea is one of the most common complaints in people with IBS. Motion sickness. Some people are especially sensitive to movement. If you're among them, the motion of a moving vehicle will make you feel sick. Eating before or after your ride can make the nausea even worse. What would you think about these? Have you experienced this or tried some? Comment down below your experiences. And if you think these are useful, a like and subscribe would be really awesome for the growth of my channel. And also, don't forget about the bell icon below. Let's get it on. When to see a doctor? Having nausea once in a while after you eat isn't cause for alarm, but you should call a doctor if it doesn't go away within a week. Call right away if you have any of these other, more serious symptoms. Blood in your vomit or stools, chest pain, confusion, diarrhea that lasts for more than a few days, extreme thirst, little urine production, weakness or dizziness, which are signs of dehydration, fever of over 101.5 degrees Fahrenheit, 38.6 degrees Celsius, intense pain in the abdomen, rapid heartbeat, severe vomiting or trouble keeping food down. In children under age 6, call their pediatrician if vomiting lasts for more than a few hours. You notice signs of dehydration, such as few or no wet diapers, no tears, or sunken cheeks. Your child is running a fever higher than 100 degrees Fahrenheit. Diarrhea doesn't go away. In children over age 6, call your child's pediatrician if vomiting or diarrhea lasts for more than a day. You notice signs of dehydration, such as your child isn't urinating or producing tears, or they have sunken cheeks. Your child is running a fever of over 102 degrees Fahrenheit. Diagnosis. Your doctor will ask you to describe your symptoms, including when you feel nauseated, how long the feeling lasts, and what seems to trigger it. Keeping a diary of what you eat and how you feel afterward can help your doctor make a diagnosis. Depending on what condition your doctor suspects, you might need tests such as blood or urine tests, a skin test to see if you have food allergies, upper endoscopy to see whether your esophagus is swollen, which is a sign of GERD, CT, X-ray, or ultrasound scans to check your organs for signs of disease, colonoscopy, flexible sigmoidoscopy, or upper or lower GI series to look for problems in your GI tract. Treatment. The cause of your nausea will determine how you treat it. Outlook. Your outlook will depend on what's causing your nausea and how you treat it. Usually, nausea after you eat will get better once you address the source of the problem. Tips for prevention. Try these tips to avoid feeling sick after you eat. Suck on ice cubes or crushed ice. Avoid greasy, fried, or spicy foods. Eat mainly bland foods, such as crackers or toast. Eat smaller meals more frequently, instead of 3 large meals. Relax and sit still after you eat to give your food time to digest. Eat and drink slowly. Serve foods cold or at room temperature if the smell of cooked food makes you feel queasy. I know it's unbearable to bear stomach pains, so I may have something that might help you. Pepto-Bismol. Well, I'm not sponsored, it's just an affiliate link where I get commission every time someone buys using my link on the description. So Pepto-Bismol is known worldwide and is a multi-symptom relief medicine. If your stomach hurts, chances are Pepto-Bismol would be able to relieve it. Don't just take my word for it. It has 10,000 5-star ratings on Amazon. Not to mention, it's #1 pharmacist recommended brand for upset stomachs. So what are you waiting for? Fix that painful stomach. What do you think about these information? Do you think it's useful? If it is, support this channel by giving it a like and subscribe. And also don't forget to click the notification bell for more interesting facts like these.